Questions 841 to 860. 841. A 21-year-old in oversized clothing presents to the hospital with feeling dizzy and fait. The hair and nail appear thin and dry. The skin appears pale and she has sunken eye socket and tenting skin. Hera body mass index is 16. She often induces vomiting after eating. Blood is collected for analysis. See lab result. Which nursing problem stem is the most appropriate? A. Impaired nutrition. B. Decreased cardiac output. C. Infective airway clearance. D. Ineffective breathing pattern. The answer is B. Decreased cardiac output. 842. Before preparing a client for the first surgical case of the day, a part-time scrub nurse asks the circulating nurse if a 3-minute surgical hand scrub is adequate preparation for this client. Which response should the circulating nurse provide? A. Inform the nurse that hand scrubs should be 3 minutes between cases. B. Direct the nurse to continue the surgical hand scrub for 5-minute duration. C. Validate that the nurse is implementing the OR policy for a surgical hand scrub. D. Ask the experienced nurse to perform this scrub since it is the first one of the day. The answer is B. Direct the nurse to continue the surgical hand scrub for 5-minute duration. 843. Which of the following statements describe the function of immunoglobulin, IgG? A. It does not cross the placenta and is present in colostrum and breast milk. B. It protects against gastrointestinal and respiratory system infections. C. It provides temporary immunity to bacteria and toxins, to which the mother has developed immunity. D. It protects against gram-negative bacteria and can be found cord blood. The answer is C. It provides temporary immunity to bacteria and toxins, to which the mother has developed immunity. 844. An infection control nurse is responsible to conduct the surveillance on how the hospital staff take precautionary measures against flu. Based on her findings, she is responsible to conduct the awareness raising for the doctors and nurses in the inpatient areas. Which of the following is the goal of the nursing practice here? A. Infection control management. B. Research and survey. C. Primary prevention. D. Health education. The answer is C. Primary prevention. 845. A 57-year-old man is admitted to the cardiac unit with palpitation, headache, and chest tightness. On auscultation, S3 gallop and murmur can be heard. See image. Blood pressure 97/60 mm of mercury. Heart rate 170 per minute. Respiratory rate 25/min. Temperature 37.38 C. What is the ECG rhythm of the patient? A. Atrial fibrillation. B. Ventricular tachycardia. C. Ventricular fibrillation. D. Supra-ventricular tachycardia. The answer is D. Supra-ventricular tachycardia. 846. Which of the following is the main disadvantages of home care visit? A. Time-consuming for healthcare team. B. Inexpensive than hospital care. C. Easy access to equipment or consultation. D. Nurses have more control on mother's distraction. The answer is A. Time-consuming for healthcare team. 847. Patient has nausea, vomiting and muscle weakness, comes to ER. After assessment, the doctor consider that sign and symptom due to A. Hypokalemia. B. Hypernatremia. C. Hyperkalemia. D. Hypoglycemia. The answer is A. Hypokalemia. 848. Patient has heart failure and suddenly has edema. What is the lung sound we'll be hearing? A. Rales. B. Ronchi. C. Wheezing. The answer is A. Rales. 49. The physician has written an order for the nurse's assignee have a 24-hour urine collection sent to the laboratory for special. Which of the following should the nurse realize prior to urine? A. Start the urine collection at either 12:01 a.m. or 12:01 p.m. B. Provide enough sterile receptacles for the urine collection. C. At the start of the collection period, have the patient discard this urine. D. Inform the patient that they must save all urine for 24, beginning at 12:01 a.m. The answer is C. At the start of the collection period, have the patient discard this urine. 850. After B. Sting, which of the white blood cell is the most likely elevated? A. Eosinophils. B. Basophils. C. Monocytes. D. Neutrophils. The answer is B. Basophils. 851. A nurse was educating a group of women on prevention of infection. The nurse asked each woman to state one preventive of vaginal infection. Which woman needs more education? A. First woman, keep vaginal area clean and dry. B. Second woman, wear cotton underwear. C. Third woman, wipe from front to back after urination. D. Fourth woman, do vaginal douche twice a day. The answer is D. Fourth woman, do vaginal douche twice a day. 852. Disadvantage of Democratic leader is blank. The answer is cannot be an emergency situation. Post-operative breathing exercise importance. A. Prevent atelectasis. B. Move secretion. The answer is A. Prevent atelectasis. 854. The quality nurse manager teaches a new nurse graduate about the comparison between total quality assurance, QA, and quality improvement, QI. What is the most appropriate statement regarding the common aspect between QA and QI? A. Aim to improve quality. B. Focus on preventing errors. C. Focus on staff development. D. View nursing activities as major tasks. The answer is A. Aim to improve quality. 855. Client has atrial fibrillation. The nurse should monitor the client for A. Cardiac arrests. B. Cerebrovascular accident. C. Heart block. D. Ventricular fibrillation. The answer is B. Cerebrovascular accident. 856. Azithromycin is prescribed for an adolescent female who has pneumonia and recurrent chlamydia. What information is most important for the nurse to provide the A. Use 2 forms of contraception while taking this drug. B. Have partners screened for human immunodeficiency. C. Decrease intake of high-fat foods, caffeine, and alcohol. D. Report a sudden onset arthralgia to the healthcare pro. The answer is A. Use 2 forms of contraception while taking this drug.